Hello, everyone. Welcome to Teal Rope and to the start of your Teal Rope training. I am Olivia Sloan. Most of you probably know me as Cadet Sloan, but here I can be Olivia, I can be Sloan, whatever you want to call me, that's cool. I am the training team lead for this year. So, me and my team are in charge of your guys' training and training for the entire club as a whole. So basically, what this can plan to look like is you are going to watch a few modules and you are going to learn the stuff on how to be an advocate, the information that advocates should know, um, moving forward. And at the end, once you guys have completed said modules, there will be an exam that you do have to pass so that we know that you know what you're talking about when you are able to help somebody. Because you wearing that rope means you're an advocate. If someone came to you and said, "Hey, I have this problem," you're going to know exactly what to do and you're going to know how to get help. So we want to make sure that you guys can be up to standard with that. We are I apologize, expecting you to have integrity with this. So please do what you need to do to make it a conducive learning environment. Take notes if you need to take notes. If you need extra handouts, please reach out to the training team and we will be able to get those for you. And just as a little PSA, this can be harsher topics or a lot of information to take in at once. So please do what you need to do to make yourself comfortable. If you need to step away, take a breather, that's totally fine. Like I said, please make it a conducive learning environment for you, um, where you can understand and be comfortable and not feel such a heavy weight if it is a rougher subject or touchy subject for you. But with that, we are going to get into the first module, which is just a little bit of like an overview and an introduction with some terms that you guys need to know moving forward within the modules. So this is module one. And this is, like I said, introductions and overviews. So basically, with this, you have some learning objectives, and essentially, you are going over all of these terms. So you're going to want to know the terms and when to use them. So, sexual assault, sexual violence, rape, sexual abuse, victim, and survivor. So, with the definitions, there are different definitions that come to sexually violent related crimes. They can vary across states as well as federal agencies. So, um, where you live will determine what these entail. Uh, Moving forward, sexual assault is a broad term that includes a range of acts. You may have an idea of what sexual assault is, and someone else may have another idea of what sexual assault is. But as a whole, it is a broad term that includes multiple ranges of acts. So with this training, you are going to see sexual assault basically used, um, sometimes terms such as rape or sexual violence, and it can all be considered the same. We'll typically use sexual assault, but other terms like rape and sexual violence can be used too. So, moving forward, we need to talk about what a victim is and what a survivor is. So, an individual determines that shift. Um, when that happens, going from a victim to being a survivor. It's not up to somebody else, it's up to that individual when they feel like they have moved from that victim status to that survivor status. Now, in this training, victim is used when we are discussing an emergency department response and that early impact, where survivor is more of a later in recovery period of time, which we recognize that it's indeed that the goal for the individuals are with the advocates and who they work with and whatnot like that. So that's basically the brief overview of terms that you guys will need to know for this. So a good key takeaway for this specific module that you'll want to know possibly for your exam is what these terms are and when to use them. So understand that the term sexual assault, sexual violence, rape, sexual abuse, victim, survivor, when and how to use those, and what they are. So, those are the key takeaways from Module 1. And also within this video, we are going to jump right in to Module 2. So I'm going to share Module 2 here. And here we have Module 2. If it shows up, there we go. Sorry, I'm learning how to use Zoom. Bear with me. We're gonna get into Module 2, which is what is sexual assault advocacy. Now, in this, we are going to be describing what a sexual assault response team is, some major roles of an advocate. So that can be you, that can be professionals in a sexual assault response team. And then we're also going to go over confidentiality and making correct decisions when it comes to that. So, the basic tenets of advocacy, you are providing victims with information, their options. You are providing trauma-informed, person-centered services because these can be super trauma-enforced um, scenarios that happen, and these people need to be prioritized. So that person-centered service is very important. You're going to work along with the victim and you are going to develop an action plan. So you're working with that victim, talking with them how they feel, what they need to do, developing that plan and getting those resources. You want to listen and believe them. You need to be open-minded. You need to listen to them and you need to acknowledge that what they're feeling is real. Don't judge them. Do not investigate whether or not they are lying or telling the truth. You want to be that open-minded, open arms person. I'm listening. I'm here. Tell me what happened, everything. I need to know. And then you guys are also a team. It's not an individual. It's not like here. You tell me everything. I'm going to go take care of it. No, you guys have to work through it together. So it is an active teamwork. With the options that the victim has, you want to explain these. So if someone comes to you and says, hey, this happened, what are my options? You're going to want to explain these three options. So no report to law enforcement and no medical forensic examination. That means they don't want to do anything. They don't want to report the person or report anything that happened in the situation, and they don't want to get medically examined for anything. No report to law enforcement, but consents to a medical forensic examination. They don't want to report anybody, but they do want to get checked themselves. To see, maybe if they have an STD or maybe they got hurt in some type of way during the incident. They can do that. And then the third one is reporting to law enforcement and getting that medical examination. So they want to report, they want to move forward with that, and they want to get that medical examination. So please make sure, in the case that if this does happen, these are what they can do. Now we're going to talk about the sexual assault response teams and forensic nurse examiners. Now, you can ask yourself, have you known anything about these? Did you even know that these were active roles like in our community at all? And if you did, what did you know about them in comparison to what we're about to learn here in a second? So, to start, sexual assault response teams. These are a group of individuals that are from different agencies who work with the assault victims. Um, this displays like an effective model of providing more centered services and better services to these victims rather than just them going to anybody and being like, oh, I need help. These SARTs, if you want to call them, or response teams, have this focus and this effective model on this service. These include crisis interventions, they have long-term counseling, there's investigations, and then they also do evidence collection. And with this, it is a more sensitive medical response to these victims because they understand how to respond to said things. And with this, the membership can vary. So at a minimum, this team includes sexual assault advocates, medical personnel, which we will discuss F&Es in a second, law enforcement, prosecutors, and crime laboratory specialists. It can also include domestic violence victim advocates, representatives of the local First Nation or tribal community, clergy, and other social service agency personnel, so like survivors of sexual assault, domestic violence victim advocates, etc. So this is how the membership can vary. Now, getting into FNEs or forensic nurse examiners, these are medical professionals who participate in those response teams, and they are specially trained medical providers for this. And so that because they are specially trained, they understand the purpose of the exam, and that is to address the patient's healthcare and emotional needs. Because like we know, with certain incidents, it's very traumatizing, it's very emotionally damaging, it can be physically damaging. And so they understand that this is a priority and they need to check these things. And like this, it's an effective model for evidence collection and for an initial sensitive response to this medical care. Now, excuse me, there's more of a need for FNEs because going to a normal like emergency department and whatnot. Um, there's long waits, and because it is kind of minimal, not many people know about FNEs. The long waits. You're not allowed to eat, drink, or urinate while you're waiting for that collection of evidence. There's an insufficient amount of trained doctors and nurses. Sometimes they do improper evidence collection, and these exams are very time consuming. When you're in an event that is traumatizing, you don't want to spend loads of time, having to relive that, having to talk about it. Maybe if someone feels the need that they need to take the time to talk about it, that's okay. But initially going through with this, it is a lot. And so there is such a need for FNEs. Now, coming back to the aspect of teamwork, there's sexual assault services, advocacy, specialized training, and teamwork that has greatly improved this quality care for these sexual assault victims. It is all about teamwork. The victim is not an individual. You are not an individual taking care of everything. You guys must work together no matter what service you're in. So, us as advocates, whoever's an advocate, they provide so much service for the victim and the victim's families if need be, utilizing this teamwork aspect of it all. Now, this pertains to us or anybody that's an advocate or the roles. So, working here in like a more defined environment, you can do crisis telephone line staffing. There's um, medical evidentiary exam response, law enforcement, state accompaniment, courtroom accompaniment, family slash significant other supportive counseling, encourage and helping facilitate F&E follow-up exams if indicated. So many advocates, you can do this to help with that action plan to the victim and move them in the direction that they need to be in. So there's two types of advocates. There's community-based and there's system-based. With the community, you are working for an independent organization and you can be present during those medical examinations with a forensic nurse examiner. And that is allowed because you're more independent and community based. But however, when it's a system based advocate, you are employed by the criminal justice system. So, like law enforcement or a prosecuting attorney's office, you cannot be in the F&E exam. That's so know that difference between the two, community based and system based. Furthering with the roles of an advocate, you can do walk-in crisis intervention, and then there's individual ongoing support counseling. So you can be counseling for or find them individual ongoing support counseling. And then there's also support group facilitation that can be utilized. Now, this is a big thing, confidentiality. Whatever happens to the victim is confidential. It is their right. They have control. and having, as an advocate, having this disclosure and understanding confidentiality, it keeps it safe. And it is completely entirely up to the victim. Now, there are some limits to this per anything. There are limits to almost anything. When it comes to certain advocates, the issues can differ along with FNEs. Some sexual assault advocates in various states have lobbied for legislation so advocates can't be subpoenaed. Um, Advocates need to understand the limits of confidentiality, and then sometimes this confidentiality can be restricted based on the affiliation of an organization or a position title and other factors like that. So sometimes you may have heard um, someone is an immediate reporter, or like for instance, cadre, they have to report something immediately upon being told. That's what they mean by, position title, affiliation, et cetera, et cetera. So, under the role of FNEs and other unique roles with confidentiality, HIPAA requires medical personnel to maintain all health-related information to be confidential. So, uh, you should know about patient, doctor confidentiality. They shouldn't go spreading anything that you say or any tests that you have unless it is to needed personnel and necessary personnel. With FNEs, they may ask the victim to sign information to, um, or I'm sorry, may sign something to give permission to release information gathered during the medical exam to the law enforcement. That's if they are, pushing forth charges and whatnot. And you can be like, yeah, I want people to know, like, this is this is what was found medically wrong with me because of this incident, pushing forward with that. But again, that is up to the victim to give permission to do that. So, some advantages of having these FNEs in a medical role is that they can testify to things that the victim says during the examination. So in court, um, they can testify to that. So if the victim tells them information that establishes that there was sexual contact forced upon them, they can testify to that in the courtroom as a medical exception and to the hearsay rule. So even if it was not an excited utterance. So that's an advantage. FNEs can be of a resource to the victim, like this is what was said, this is what was told to me during the medical examination, and then even if it was forced, that too. So, this is how you maintain confidentiality. You don't talk to the media unless the victim says otherwise. You don't use the victim's name when you're talking with other people. So, I'm not going to go to work if I'm an FNE or an advocate or anybody and it's someone that has nothing to do with anything. I'm not going to go and say, hey, so and so told me that this happened. No, don't do it. Do not do it. You don't talk about it with your family. Don't talk about it with your friends or your spouses. Confidentiality. You and the victim, and maybe their family. You guys are a team, not your boyfriend, not your best friend. Please maintain that. In a public place, don't talk about it in a public place because now you got strangers. You're telling a stranger's business that's traumatizing to strangers. And then don't use any details for any purpose. Not using any of those case details for purposes. Um, Pretty self-explanatory about keeping that under wraps. But moving forward, that is module 2. Some key takeaways for this along that align with the learning objectives is the description and how a sexual assault response team is comprised. So remember, it's those group of individuals that are working with those victims and how it is an effective model and everything that is included within that, and then how they take on to this in a sensitive manner to these sexual assault victims. And then understand how many roles um, there are six roles that you can do, six roughly. Understand those. Remember, you don't have to have them all memorized, but understand their importance and what are some things you can provide. And then know confidentiality and what that means and how to make appropriate decisions when it comes to that. So that was module two, and along with some of module one. I hope you guys are enjoying it so far and you feel great. You feel very, I know it's a lot, it's a deep topic, but I hope you guys feel uplifted that you are learning how to be an advocate and that you are a step closer to being fully trained, to knowing that someone can fully come to you in support of that. So I will see you guys in the next lecture and have a good one.